think we'll sit here. This is not going to be a psychoanalysis, so I'm not going to ask you to lie on the couch while I'm standing behind you
But I just want
going,
to tell you about my childhood, Ethan.
okay, well, we can get into that later. Well, I think that the audience would benefit from hearing your story. I would just observe that everyone's had a chance to meet you on stage, and certainly they'd be impressed with your intelligence and articulate nature, but what happened to you?
Woof, yeah. So 1 year ago, last May 2nd, I was on my way home from a cannabis investor conference after party doing my journalistic work, and I was in a Lyft. We were 2 blocks from my house. I was almost home. We stopped at a traffic light. My head was up against the headrest, and I heard a very loud crunch from behind me, and suddenly sort of became aware I was in an accident, and I was very disoriented. I was suddenly totally concerned. Something was very wrong. What was wrong? I looked down. I was like, am I bleeding? I'm not bleeding. I took my seatbelt off. I got out of the car. I was in really intense pain along the back of my head, but I was also, I guess in shock and sort of, called one of my best friends, said, hey, I was in an accident. Do you think I need to go to the hospital? It was after 11 o'clock at night. He was at home doing work. He Googled concussion symptoms. He said, oh, well, do you feel dizzy? And I was like, no, I don't feel dizzy. And he was like, oh, well, do you feel sensitive to light? And I was like, looking at the traffic light. I remember looking at it and thinking, I don't feel sensitive to light. I think I'm fine. Everything's fine. And walked home. And haven't quite been the same since. I have what turned out to be a pretty serious concussion. I've since been diagnosed with post-concussion syndrome and issues with my neck, PTSD, adjustment disorder. I have memory issues. I have cognitive issues, really severe headaches, nausea, insomnia, emotional problems, decision-making problems. I wrote them all down so I wouldn't forget. And then perhaps most debilitatingly have a sensitivity to sound that is so intense that it's actually incredibly rare for me to be in an environment like this one. I can't really stand in the hallway for more than a couple of seconds because the voices and the dissonance and the sound makes me physically ill. I'm suddenly in this Kafka-esque situation where I'm allergic to sound. So I've stopped listening to music, I've stopped watching television, I've stopped going to parties, I've stopped going to restaurants. I am nearly 13 months into this brain injury situation.
Well, people may be confused. It sounds like you weren't actually knocked out. Did you lose consciousness that you're aware of?
So, great question. I have no idea, no one was in the car except for the Lyft driver. The Lyft driver is obviously not my friend. He didn't look back to check on me. He got out of the car to have a verbal argument with the guy who hit us. I remember sort of coming to, was there a time when I wasn't conscious? I have no idea, and I really don't know.
Well, she's pointing out one of the things that's really misunderstood about this situation, which is you certainly can have a concussion without actual loss of consciousness, and that it's entirely possible and not unexpected at all to develop a whole constellation of symptoms such as you describe for what other people would interpret as a minor accident.
Yeah, no, I think there's been a consistent narrative pushed on me that perhaps some of this is in my head and I'm exaggerating or I think something's wrong, but it's not a real physical symptom. And that's very baked into all the treatment from the beginning. It took first, it took 2.5 weeks for me to decide that it was serious enough that I really needed to go to a doctor, which was this awful, harrowing experience. But by the time I made it to the doctor and they did a scan to see whether my brain was bleeding, and then they said, well, your brain's not bleeding, you're going to be fine in a couple of days, here's 3 Valium. And I was like, okay, great, I'm going to be fine in a couple of days. Several days went by, I was very much not fine. You know, I make it to a doctor and they're like, oh, well, you're probably going to be fine soon. And then it was, oh, you're probably going to be fine in like max a couple months. You know, and then it was after the 6-month period where they said, oh, well, yeah, 90% of concussions are going to clear up within the first 6 months, but if you make it past the 6-month period, you're certainly going to have cognitive deficits for well over 6 years.
Boy, I never made a prediction like that. What tests did you have done?
What tests did I not have done? Okay, so I've had a CT scan. I've had an MRI with contrast and without contrast. By the way, with contrast, they like inject ink into your body. It feels very weird. Or maybe not ink, like something that causes a color. I've had an EEG. I've had a QEEG, Queeg, as I like to call it. I've had really extensive neurocognitive testing. I can tell you how many numbers I can memorize now. It's about 7 or 8. And, you know, it's really weird because not only did I keep getting like, oh, you're fine, or oh, this is maybe, you know, these are psychological things, or like, let's talk about your childhood, maybe it's really about that. I did get a lot of, you don't seem to have a cognitive issue. And I hear this from a doctor that I've never met before. And I'm like, you have no idea what I was like before this. And I remember in a really deep fog, you know, I've improved, but the really deep fog that I was in last summer, you know, meeting with a neurologist and saying, you know, I think I'm kind of smart, so I don't know how you're gonna measure my memory to figure out what's wrong with me because you don't have memory testing from before. And he just like didn't respond, and I was like, oh, maybe I'm being like a conceited jerk by pointing out that I think I'm smart, but it's this very weird issue where I'm like suddenly having to like answer for these things where I'm like, no, I could memorize more numbers before.
Well, were there any discrepancies in like the percentiles
There
of your
were,
performance?
yeah. So in the original neurocognitive testing that they did last fall, the first round, my like verbal intelligence, I'm paraphrasing because I don't remember the exact numbers, but something like verbal intelligence was in like the 95th percentile, and then my working memory was like the 70th percentile, and my processing speed was like 60-something percentile. And so, you know, the guy who evaluated me said like, yes, you know, it's clear she's showing some impairment. And then his next sentence was like, in the report was like, but the worst part is how upset she is about all of it. And I was like, what? I was like, actually, the worst part is I can't like listen to music anymore. The worst part of it is I feel physically ill when I'm in a room full of people. I'm actually handling this in a pretty chill way. So, and then honestly, even the diagnosis of post-concussion syndrome, which is what you're going to get if you are still experiencing symptoms after, I think, 6 weeks or something, you know, I've felt that this is a diagnosis that is like throwing me shade, right? Because, oh, it's actually your post-concussion? Like, why do you have symptoms still? Like, the concussion's over. Like, you're post. Like, what's wrong with you? And I'm just sort of like scrambling to explain, like, why I'm still, you know, experiencing terrible symptoms.
Yeah, sure.
Do you want me to tell you about all the things I've tried?
Yeah, that'd be interesting. What kind of treatment have you had?
All right, so acupuncture, very helpful. I'm doing something called neurofeedback, which is a form of biofeedback, and I'm doing a passive form of neurofeedback where I really refer to this to most of my friends as brainwashing. I swear to God, this is what it is. They hook up like sensors or some kind of ultra-low frequency something to my brain, and then I watch old movies. I don't know. This is a thing that I'm doing. I'm doing craniosacral therapy. I'm doing physical therapy for my jaw, because apparently that's going to affect my ears. Because a lot of stuff on your face. This is just that I didn't even really realize before. There's a lot here, you know, that you need for a lot of different things. But honestly, the thing that makes the most difference is resting and staying away from sensory stimulation. So putting on a blindfold, putting in earplugs, and sitting quietly on my couch for 2 hours. Also, bone broth, cannot recommend it enough. A little bit of Tylenol and cannabis.
Sure. Were there other drugs that you were prescribed?
No. You know, it was like that 3 Valium. I don't even think I took all of them. And then, no, really nothing. So, but I take tons of stuff now. You know, I take Chinese herbs multiple times a day. I'm taking probiotics. I'm taking magnesium. I'm now taking ginkgo biloba. What else am I taking? Oh, and then you know, every day it's like half the day I'm in consideration of what's the next appointment I need to get to, what's the next physical therapy exercise I'm supposed to be doing, you know, am I eating enough avocado and salmon, and am I getting enough omega-3s, and my entire life has sort of oriented around my brain health.
What about cannabis? Have you tried it, and what were the effects?
So, you know, this is so interesting. Years ago when I was like a, you know, cub weed reporter, I remember doing this little item for LA Weekly where I spoke to a doctor who had reviewed some data that showed if you had cannabis in your system, when you got a traumatic brain injury from a car accident, you were more likely to survive and have a better outcome. I was like, that's so interesting. You know, lo and behold, just before I got into the car, so about 45 minutes before the accident, I had smoked some 2-to-1 CBD to THC cannabis. Then, you know, I trudge home totally unaware of how serious the brain injury was at that moment, and it's like 11:30 at night. All my responsible friends were asleep. You know, I was sort of really confused about what am I doing here, and had this memory of, oh yeah, like brain injury, CBD, maybe I have a concussion, and was like, what CBD do I have in the house? And I had some 1-to-1 mints, and so I took 20 milligrams of CBD and 20 milligrams of THC less than an hour after the accident. And then in the wake of really understanding, you know, as more of the symptoms showed up in the days after the accident, and I, you know, sort of became aware, like, okay, I definitely have a concussion. I remembered having conversations from my time as a journalist, mostly with football players, but also with other folks about their concussions, and had this, you know, instinct that someone had told me like 3-to-1, 2-to-1, these were the ratios I should be looking at. You know, I went to a dispensary that first weekend and I picked up a 3-to-1 CBD to THC vape pen and immediately felt the difference. And since then, you know, have had a consistent donation of cannabis tincture from a close friend of mine in California that I've been able to sort of adjust the dosage as I go. When things were really bad last year, you know, was sort of on it most of the time, and now sort of use as needed. But it's been like all, you know, medication around cannabis, sort of me alone in my house, hoping I'm not doing anything that's making anything worse.
Well, hopefully that's not the case. Perhaps we'll transition now into PowerPoint, a little bit about head injuries.
Thanks, Ethan.
So, yeah, that's me playing absent-minded professor.
That's an act?
Well, you can tell me how well I do it. So 5% of sports injuries are concussions, and there are 300,000 annually in the United States. As we've heard, loss of consciousness is not a necessary criterion for concussion, nor for the development of post-concussion syndrome or post-traumatic syndrome, the symptoms of which you've heard. So this consists of headaches that are very much akin to migraine headaches. So they can be pounding, they can be quite severe. They're associated with what's called photophobia, sensitivity of the eyes to light, and phonophobia, the sensitivity to noise. Additionally, nausea, dizziness, possibility of vertigo. It is not a nice feeling at all. So traumatic brain injury is the #1 cause of coma. There are other causes, such as when there are metabolic problems or depressive drugs. Recovery can be very prolonged, as we've heard. The conventional wisdom is if the symptoms persist for a year, that's going to be permanent, but the conventional wisdom is not always the case, and there's certainly things that can be done to allay that. As this crowd probably knows, both tetrahydrocannabinol and cannabidiol are neuroprotective antioxidants. That's a fancy way of saying that they help reduce the effects of brain damage, whether it be due to trauma or things like strokes or other diseases. An antioxidant is something that prevents rust. Rust in the brain means deterioration in the normal structures. Additionally, particularly cannabidiol is what we call anti-glutamatergic. Glutamate is a stimulatory neurotransmitter. However, in head injury, there is a superabundance of glutamate, so much so that it produces what's called glutamate excitotoxicity. This means that the cells stimulate themselves to death. And so this often will lead to a worsening of a person's neurologic condition after a head injury. What we know from people who've tried it is that cannabis can be really helpful in treating a post-traumatic syndrome, particularly when you've got some combination of THC and CBD. And they treat the various symptoms: the headache, the nausea, the insomnia, dizziness, agitation, tendency to substance abuse, which is not helpful for the syndrome, and also for psychotic symptoms that are associated with what we're going to discuss next, which is the most severe form of post-traumatic syndrome. This is what's called chronic traumatic encephalopathy. Now, this actually isn't a new condition. It's been more recently associated with professional football players, but also happens in kids that are quite young, that are engaging in football or other contact sports. The old name for this was dementia pugilistica. What that means is loss of a memory associated with boxing. And there are various syndromes associated with boxing, including the punch-drunk syndrome. But what we've got is a constellation of progressive memory loss, personality change, rage, psychotic behavior, attention problems. The study that you see on this slide for a neuropathology of this disorder, they looked at a sample of American football players who had died and had autopsies, and 87% showed evidence of chronic traumatic encephalopathy with changes called tau aggregates in neurons. These are abnormal accumulations of proteins, and in astrocytes, those are the supportive cells of the brain cells. Neurofibrillary tangles in areas of the brain, also in the hippocampus, the area involved with memory, and beta amyloid deposition. Now, a lot of these are analogous to the changes of Alzheimer's disease, but the pattern of them is different so that someone looking at these under the microscope can tell the difference. Additionally, early on, the presence of microglia. These are inflammatory cells of the brain. And basically, everybody that has this syndrome has a degenerative course, meaning it gets worse over time. Now, previously, this was considered a postmortem diagnosis, that you couldn't diagnose it for sure until somebody was dead and you had their brain under the microscope. But there actually have been some tests that have been developed to diagnose this positively before the person has died. One is cerebrospinal fluid done with a spinal tap and looking for something called CCL11, and that was elevated compared to controls and different from Alzheimer's disease patients, and the amount of it correlated with how long someone had played football. Additionally, positron emission tomography can show differences in binding in the brain in patients before death that also relate to how much of this tau material has been deposited. Okay, less severe situations. What are the existing treatments for concussion? Well, as Amanda stated, rest is good, avoidance of excessive light and noise, avoidance of alcohol. Ethanol is really bad in this situation. We encourage people to slowly resume activity, and you'll note with athletes that have concussions, the first thing they do is have them exert and see if that makes the symptoms worse, because typically it does, and until it does not, they really can't play again. A lot of non-steroidal anti-inflammatories are recommended, although these are bad for the stomach, and they also may increase the risk of a late hemorrhage. Antidepressants are frequently prescribed, but rarely do anything of benefit. And I can tell you from many years in practice that these approaches are rarely helpful. What I did when I was in practice trying to do integrative neurology was quite different. I was very fond of ginkgo biloba, which is derived from this plant with the beautiful fan leaves. Very strange plant. There's only one species of this. There used to be hundreds in ancient times, but only this one has survived. And it's a tough tree. It was the first thing to grow back after the atomic bomb in Hiroshima, and it also survives as a street tree in New York City. Now, as a typical botanical medicine, there isn't a single active ingredient. You actually have to have a combination of 3 compounds called ginkgolides, bilobalides, and ginkgo flavonoids. There are 2 kinds of very standardized extracts that have been through very extensive testing, including randomized controlled trials. They both come from Germany, and if you were ever buying ginkgo, you'd want a preparation that fit this description. In terms of what it does, we know that it increases tolerance to oxygen lack, hypoxia. It actually reduces swelling of the brain, cerebral edema, after head injuries or related to toxic exposures. It increases the uptake of choline in the brain. Choline is one of the things you need to make acetylcholine, the memory molecule in the brain. And so it is neuroprotective. Normally is used to treat dementia, like in Alzheimer's disease, but I found it quite helpful in post-concussion syndrome as well. Another preparation I really liked a lot in practice is chelated magnesium. Most magnesium is mineral magnesium. It's a laxative. It doesn't get absorbed, and it isn't going to help headaches. But rather, chelated magnesium will be absorbed, and for migraines, I noted about a 70% improvement in reduction or even arrest of the headaches. With post-traumatic syndromes, the numbers are always lower in terms of the response rate. Typically 200 milligrams 3 times a day with food, About 5% would get diarrhea from it, usually responding to a lower dose. Another thing I used a lot, extremely safe and useful, is ginger, Zingiber officinalis. This is what the roots look like if you've never used them in that form. And the plant's really beautiful, as you see on the right. These can be used in a variety of different ways. It's extremely non-toxic. It's even safe in pregnancy for morning sickness. You can use it as a fresh root. Quarter size is good enough. Tea, real ginger ale, not Canada Dry, or ginger beer, or just these capsules. Ginger's really versatile. If you get a big root and you don't use it all, peel it and stick it in some sake or in sherry, and it'll stay forever in the fridge. A product I'd thought of years ago, never bothered to patent, was this. It's called a Catalyst Cryo Helmet, and it has that stuff of cold packs. You stick this in the freezer, so when you have a headache, you can put this on. And you too can look like a Russian cosmonaut. But after a head injury, this is being used by some sports teams to put on immediately, and it may reduce symptoms. We don't have great evidence yet that it can really arrest the development of a post-traumatic syndrome, but it's worth a try. And it's nice because there are no drugs involved. How about cannabis? Well, this is how I suggest it be used in this situation. When I was in practice prior to 2003, I used cannabis adjunctively with my patients when we tried these other things. At that time, pretty much we didn't have the range of things that we do today. So people had cannabis to smoke, and it was THC predominant. There was no CBD around for practical purposes. But what I found was tiny doses were all that was necessary. One toke, perhaps, and have people wait 15 minutes and see if they needed any more. Just enough to lift the brain fog. Brain fog is, I can't think, or it's too hard to think. And it was amazing how often patients found tiny doses were helpful, also to treat the symptoms of headache or dizziness. When people had a more chronic involvement, it certainly would be the case that we'd recommend modern oral preparations, particularly tinctures or oral mucosal preparations. As I said, in the olden days, we got by with THC predominant preparations, but certainly now we'd recommend type 2 or type 3 chemovars with significant cannabidiol content. Additionally, for this kind of crowd that's keyed into this kind of thing, certainly we'd recommend a terpenoid profile to maximize the benefits. Pinene is going to reduce short-term memory impairment from the THC and would help with the cognitive impairment from the condition itself. Limonene would help with mood, and caryophyllene would reduce pain and inflammation. So you might look for profiles like this. So we've got here two type 2 chemovars, roughly equal amounts of THC and CBD. On the left, you've got a profile that's high in the green. That's alpha-pinene. Pinene is an acetylcholinesterase inhibitor, so it increases the amount of acetylcholine, the memory molecule. And again, short-term memory impairment is one of the cardinal symptoms of post-traumatic syndrome. On the right, we've got a good amount of caryophyllene for that CB2 agonism, good on inflammation and pain, and a good amount in yellow of the limonene for benefit on mood as an antidepressant. And I think that's all we have for slides.
I love this cartoon of you. Thank you, Ethan. Thinking about all those things gave me a headache.
Sorry.
It's all right. Science. Okay, so I have several questions, and I think the first one is sort of the most important. While I was trying to, do this stuff on my own and make these decisions through the brain fog, getting so much information pressed that CBD is this wonderful, magical, perfect, non-intoxicating, ideal everything, and THC is the evil, bad, hurt your everything, stay away from drugs, reefer madness, compound. And of course, we know that's a real duality. I also became very concerned that THC might be bad for my brain. People were certainly trying to convince me that THC was bad for my brain. And so to clear things up, is THC, if I perhaps take more than one hit of the joint and I don't wait 15 minutes in between them, and I happen to not have taken CBD yet that day, is THC bad for my brain?
No, I don't believe so at all. Again, there's always the possibility, that it would make you more anxious or that kind of thing. But the key thing here is in any situation medically would be titration, using the amount that's going to reduce symptoms without producing additional problems in terms of impairment.
Right. So if I feel too confused from the THC, then too much THC, add a little more CBD. And I've been doing that.
Right.
Yeah.
And again, I never accepted this dichotomy of CBD as the good cannabinoid and THC as the bad cannabinoid.
Right.
I'll just state there's nothing that CBD does that won't be improved with at least a little bit of THC.
And I've found that when, I'm dosing myself, in the morning and I say, okay, I have a headache right now, the Tylenol isn't really working, I'm going to take 75 milligrams of CBD and I'll take it pure, I won't feel as much of a positive effect as if I take 25 or 50 milligrams of CBD and a teeny amount of THC. I will feel much more like a calming and headache go away.
Right. Well, that's a very good observation. In fact, we know from epilepsy studies that the amount of CBD that's necessary for control is about 5 times more than if there is some amount of THC and other components present.
Okay, and so one more follow-up in that vein, because I did have someone, a doctor with a cannabis professional suggest to me, well, we know that THC is bad for the developing brain, for maybe adolescents. So I guess I'm curious, is there a difference between the developing adolescent brain and the injured brain?
Yeah, there are differences, but again, let's take issue with the adolescent brain. If the question is, do I think it's fine for teenagers to do bong hits all afternoon instead of playing sports or studying, the answer is no. However, we need to make the distinction between huge recreational doses of THC versus tiny amounts used therapeutically to allay symptoms. Those are really different things.
Yeah, absolutely. Okay, I feel a little better. So another thing I'm really, coming up against, and I think partly framing, my own judgments of myself and concerns about this, is the way that I try to talk about using cannabis to my doctors. Because, I've seen medical records from one of my doctors that say I have a substance abuse problem because I use cannabis every day. And, now I've sort of just taken to saying like, oh, and I'm using CBD because people sort of know what that is, and there's no reason for me to get into more details of, well, I'm using a CBD dominant preparation and blah, 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 blah. But I guess, do you have any advice for when I'm interacting with medical professionals who haven't been educated in cannabis, how I should or could be explaining what I'm doing and why, why they should believe that I'm not just a pothead?
Well, it's a tough one, but hopefully you could provide them this video. And maybe they won't believe what I've said. But no, it's a serious problem. You always have the option to throw them some literature. However, there are serious problems in modern medicine in this country, and one of them is a doctor can't make money unless they're seeing another patient every 15 minutes. It's not amenable to cannabis-based medicine, which requires a lot of explanation, and trying to overcome all the misconceptions and propaganda that we've been fed for decades. So I make no excuses for my colleagues, but sometimes it's necessary to see someone who is more oriented towards this, and it could be a naturopath or some other kind of doctor that has a background in botanical medicine, let alone cannabis.
Yeah. Do you think it would be possible for changing med school education to incorporate more of the endocannabinoid system, what we do actually know, what we do have peer-reviewed studies on, stuff that the NIH has been funding for a long time, is that going to be part of the conversation moving forward, especially on the federal level?
Inshallah, in my dreams. There's a tremendous deficit. It's been almost 30 years now since the discovery of the endocannabinoid system. Forget cannabis for a minute. What if I told you that there was a system in our body that was the major homeostatic regulator of every physiological function, that there are more CB1 receptors in the brain than there are for all the neurotransmitters combined? Don't you think that doctors should know about that? And yet, this is not taught in medical school. There are only a handful of places where this is part of the curriculum at all, and that's totally inexcusable. It has nothing to do with cannabis. Cannabis is only 28 million years old. The endocannabinoid system is hundreds of millions of years old. And by the way, it wasn't put on God's green earth to make us high. It's just a happy accident of nature for which we're the beneficiaries. But yeah, no, this needs to be taught in medical school, and this is one of those things where, I hate to term it this way, but it's a bottom-up education. The patients are going to initially need to at least indicate to their doctors that this is something that helps me, and hopefully she or he will take that to heart and look into it.
It's very frustrating because, you are quite unique in the sense that we really have, this sort of Western medicine establishment that's, generally under the impression that if I'm using cannabis to alleviate these symptoms and, a high CBD variation is going to be really helpful, much more so than Tylenol, that suddenly that means I'm a drug addict. But then on the other side, we have essentially the modern pill mill, which could be the, medical cannabis doctor who's just making all this money, throwing out recommendations to anyone who wants them. And obviously, I think we're sort of moving past that era a little bit, but I do think that, there's the other side of things, which is people are like, hey man, you got a brain injury, like you got to smoke weed all day. And I'm like, no, that's not what's going on here. Like that was never what was happening in my life. And so I feel like there are these two extremes, and then there's this like very thin line in the middle, and it's like you and like 10 other people, like for real.
Well, there are more. People need to find a doctor that's oriented in this manner. You could look at the Society of Cannabis Clinicians. They keep a listing. I'm glad you brought this up because it gets into the standard of care. The standard of care for cannabis-based medicine is the same as for anything else. This requires a long appointment where the history is done, the person is examined, risks and benefits are discussed. And again, that's not a good way to make money, but that is good medicine.
Yeah, it's hard. So I have one question. I'm so curious to hear what you think that has been sort of the central question and problem, I think, of the past year for me, which is what will help me more to rest and not push my brain to do things like this, which I'm going to have to recover from later alone, avoid music, not do work, don't do the things that are potentially causing pain, or will it help or not make anything worse if I am, say, pushing myself as hard as I possibly can to do my job and make enough money to survive and move forward while continually making myself sick? I mean, I think the sort of, it's because there's sort of like, you could have like there are physical injuries, there's two types of injuries, right? There's you want to rest for it to get better, and then there's the rehab as you go, so that you're like continually using it so that you don't, lose the use of something. And I think there's really very divergent opinions on this. I get doctors who are fully on one side, I get doctors who are fully on the other side, and it's really hard to sort of, reconcile that.
Yeah, well, the answer is really clear to me. You don't gain anything by pushing it. One of the things I always would tell a patient I was seeing for the first time with a post-concussion syndrome was, look, we expect you to improve, but it's going to take a long time, and you can't push this. You really have to lower your expectations, and the lower your expectations are, the less likely it is you're going to be disappointed. I really tried to get people to take time off, give themselves a chance, not expect much of anything, and impart that to their family. I mean, most often it is a situation such as yours, where people will look at you and say, you look fine, and you sound fine, but you know that it's not the case, and that makes it really difficult.
Cool, yeah, so just rely on those savings then. Got it. And I think that, I would just say, the other, I guess, sort of, in addition to the complex science, which did sort of physically hurt to think about, certainly the hardest thing to see in your presentation is this idea that after 1 year, symptoms are permanent. And, it's the same as this 6-year thing, which wasn't something a doctor just sort of said. It was something he was reading from, a study of veterans. It wasn't like his opinion. It was like, well, this is what the study shows. And, I'm pretty sure there are, studies around cancer where it's like, if you believe you're going to get better, that makes you much more likely to get better. And I guess I'm sort of struggling here, like, the sound thing, like I said, is the most debilitating thing I'm experiencing. I'm going in for another test of the pressure in my inner ear on Monday. I think nervousness and anxiety leading up to that around, will it be a better number than it was in January? Am I even getting a little bit better, or is this, something I could potentially live with? It's very difficult to confront, and I'm now asking for a small pep talk about potentially, can I, with strength of will and by trying all of the things all of the time, maybe still see more improvement even though it's been over 1 year?
I fully expect that you're going to continue to improve. Plus, it's truly a testament to you, your capabilities, on strength of will, that you're here doing this today. I really admire your capability.
Thanks, Ethan. I admire you too. It's kind of intense. Yeah, so I guess, I don't know, first of all, if someone has a serious head injury, maybe take them to the hospital, because even if they're totally coherent, their brain could be bleeding and they could die, which fortunately is not what happened to me, but later I learned and was very scared about. Just because someone appears healthy and coherent to you certainly does not mean that they are. And are there other takeaways that we should wrap up with here?
No, that's good advice. People really need to be be evaluated, and again, there's always the potential they're going to worsen over the course of the first 3 days. And so there's a hidden danger of this situation. Also, a serious mistake to get back into contact sports too early, and I see this constantly. I really hardly watch football anymore because of this, let alone boxing or that. I still like hockey, but I don't like some of the hits. So yeah, it's we need better public health and education on this as well.
Well, I really appreciate you taking the time to explain this to all of us, and especially to me. I am now taking ginkgo because of Ethan, so that feels like hopefully it will move me in a better direction, because why not just try everything?
You bet.
Thank you so much.
My pleasure.